mynews.studio.
Across 4 out of 5 countries, deaths from chronic diseases dropped sharply. But now, that progress seems to be stalling. What's going on?
Today is December 4th, 2025. Let's get into what some experts are calling the most dramatic fall in chronic disease deaths in recent history. Between 2010 and 2019, most countries managed to reduce deaths from heart disease, stroke, and major cancers. But is the story as straightforward as it sounds?
It's a major step forward. To put it in numbers, 152 countries saw fewer women dying from chronic diseases, and 147 saw reductions for men. The main factor was cardiovascular disease. Heart attacks and strokes became much less fatal. Cancer screening also improved. More cases of stomach, colorectal, breast, and prostate cancer were caught early.
Was this driven by new technology, or did countries just get better at using what they already had?
Mostly, it was about using what was already available. Things like statins for cholesterol, medications for high blood pressure, and tougher rules against tobacco and alcohol. Those made the biggest difference. These aren't new or expensive treatments. They're established public health strategies.
Some regions really outperformed others. Which countries made the biggest leaps, and why?
South Korea stands out, especially among high-income nations. By 2019, it had the lowest chronic disease death risk for women, and was 4th lowest for men. Their approach? Keep investing in prevention and healthcare access, even when things are already going well. The Nordic countries, Denmark, Norway, Sweden, also kept up the momentum. Denmark, in particular, kept mortality rates dropping for both men and women, thanks to strong public health care and prevention programs.
How about outside the wealthiest countries?
Chile and Colombia led the way in Latin America. Chile's drop in chronic disease deaths is especially striking. It's now lower than in the United States. That happened through better care for strokes and diabetes, more cancer screening, and action on chronic respiratory diseases.
Eastern Europe isn't usually mentioned in these discussions. Did any country there make big gains?
Moldova made the biggest strides in that region with sharp declines for both men and women. Russia and its neighbors also saw improvements, mostly because of stronger alcohol regulations.
And what about China?
China achieved major reductions, especially in deaths from chronic obstructive pulmonary disease. Efforts to control smoking and improve air quality really paid off. The common thread in all these successes is consistent, broad public policy and making sure everyone has access.
But after 2010, things slowed down. What changed?
That's the concern. In about 60% of countries, including nearly all high-income ones, the pace of progress dropped. Why? Preventive care stalled. Expanding blood pressure and diabetes screening slowed, and cancer screening didn't grow as quickly. The systems that drove early gains have hit a plateau.
The United States really stands out here, doesn't it?
It does. Among wealthy nations, the U.S. had the smallest drop in chronic disease deaths. For women aged 30 to 70, the risk of dying from heart disease, cancer, COPD, or diabetes barely moved in the last 10 years. Even more troubling, deaths from chronic diseases actually rose among Americans aged 20 to 45.
Germany didn't see much better outcomes. In fact, lung cancer and dementia deaths among women increased.
Right, and it wasn't only about how health systems performed. The types of diseases causing deaths have shifted. Dementia, neuropsychiatric conditions, and cancers like pancreatic and liver cancer have become bigger threats. These are harder to prevent than heart disease.
Why is dementia becoming such a major concern?
It's partly because populations are aging, but also because we don't have easy prevention tools for dementia. There's no simple medication, like for high blood pressure. It takes early cognitive screening, changes in lifestyle, and strong long-term care systems, which aren't always available.
What about pancreatic and liver cancers? What's effective there?
There's no routine screening for those. Prevention means reducing tobacco and alcohol use, vaccinating against hepatitis, and making early treatment more accessible. Research on better detection is ongoing, but we're not there yet.
Alcohol-related diseases are also rising. What policies actually work?
Taxing alcohol, limiting its availability, and regular screening in primary care are all effective. Russia's changes in alcohol laws led to sharp drops in deaths. The main issue elsewhere is that these proven steps aren't always put into practice.
So, should the focus return to prevention, but more broadly and deeply?
Exactly. We need to reimagine screening programs, make preventive care routine in primary health care, and focus on underserved groups. And we can't forget that health depends not just on medicine, but on policy and equity.
Are there signs that global progress could pick up again?
The examples are there: South Korea, Denmark, Chile, Moldova. What they share is steady investment, political commitment, and sticking to evidence-based policy. The UN's goal is to cut these deaths by a third by 2030. It's possible, but only if more countries follow these leads.
If countries don't adapt, are we looking at chronic diseases staying the leading cause of death for another generation?
That's the risk. The slowdown isn't set in stone, but turning it around will take renewed focus.
Let's recap. In the last decade, most countries brought down chronic disease deaths, mainly through prevention and public health policy. But progress has slowed, especially in richer countries, as prevention efforts stall and new challenges like dementia and certain cancers become more common. The path forward is clear from countries that kept improving. Will others follow?
Thanks for listening. This episode was brought to you by mynews.studio. Try it now for free.